Type A dissections represent a true emergency since the sudden occurrence of cardiac tamponade, free aortic rupture, or a malperfusion event such as a stroke or acute myocardial ischemia can be fatal. The main objective of corrective surgery is to replace the proximal aorta, establishing safe and efficacious extracorporeal circulation. There is an ongoing debate on the choice of cannulation strategy used to establish arterial inflow, with the options being the femoral artery, the right axillary artery, or the ascending aorta itself. Since no clinical trials are available for the validation of each technique, the strategy of choice can only be based on best evidence practice. Of these, right axillary cannulation has displayed better short and long-term survival and lower incidences of stroke. It successfully maintains antegrade aortic flow and allows to easily establish selective antegrade cerebral perfusion during hypothermic circulatory arrest. Here, a simple technical modification is made to the procedure using an arterial perfusion cannula inserted through an 8 mm Dacron graft sewn into the artery. The axillary artery is exposed in the right deltopectoral groove according to an earlier technique described by the author. In doing so, the present technique improves arterial inflow by reducing high flow resistance and bleeding at the cannulation site and eliminating the risk of overcirculation to the right upper extremity compared to the standard technique of direct inflow into the Dacron graft. There is no holy grail in the treatment strategy of type A dissections. Its complexity, the rapidly changing conditions, and the multiple unpredictable variables that can affect its presentation and evolution make it impossible to define a strategy that works for every case. The key to optimize results is to tailor this strategy to the patient. Nonetheless, based on best evidence practice, a few aspects of the surgical treatment of acute type A dissections seem to be accepted as safe and effective enough to be considered mainstays of therapy. It is fair to recognize that, based on positive results shown, axillary artery cannulation should be strongly considered as a part of the standard of care in the surgical treatment of type A dissections.